Right, sir. It is live. You can start.
Yeah, it's preparing for live stream. Yeah, it's done.
Very good morning to you all. On behalf of the Indian Pharmaceutical Association, we are very happy to welcome you for this new initiative of the IPA Community Pharmacy Division, which is an antimicrobial stewardship initiative. It is a very important landmark for all of us, and I welcome all pharmacists, academicians, regulatory authorities, pharmacy students, practicing pharmacists, all walks of pharmacists for this launch. We at the executive committee and the special interest group of IPA Community Pharmacy Division have been working towards making this launch. It's been a long pending requirement in the country, and we are very happy to launch it, and we are very happy that all of you are present here today. So I welcome you all, those on the Zoom link as well as those who have joined YouTube Live, and even those who would be seeing this recorded version later on. Some housekeeping rules from us. Please mute your microphones and your videos, so that will help us so that there is no disturbance. Please feel free to ask any questions to any of the speakers or any of your queries. Please type them in your chat box, whether it is in the Zoom link which you are following or it is in the YouTube. We will try and answer our in the best possible way, whatever we can during or after the towards the end of the program. So this program is going to be a maximum of 90 minutes, and we are starting off. We have already started off. So today we will have various presentations from experts across the world. There will be some discussions and also several announcements to make. Towards the end of the program, we will share a Google form with you so that you can please give us your feedback. This feedback for us is very important. And please do become a member of IPA, those who are already not, so that you can join us in a much more productive manner for our programs and future activities. That's me, myself, Raj Vaidya. I'm a practicing community pharmacist in Goa. I'm the immediate vice president and chairman of IPA CPD, and also the editor of the E-Times of IPA CPD. And to join me today for this AMS initiative is my co-lead, that is Professor Sunitha Srinivas, who is also visiting professor in Rhodes University, South Africa, and a member of the special interest group of IPA CPD. A detailed biodata of hers I'll present to you later when she makes her presentation during the course of this program. Just a brief of the Indian Pharmaceutical Association, which was established in 1939, and it is the oldest and largest premier association of pharmaceutical associations in India. It operates throughout India with 26 state branches and more than 46 local branches. Do visit our website and learn more about it. And those who are not members, please do become members of IPA. IPA operates through various divisions depending on the interest of the members. We have the industrial pharmacy division, the hospital pharmacy division, the education division, the regulatory affairs division, and we are in the community pharmacy division. We have a very important component in the IPSF, that is the IPS Students Forum, which operates under the education division. IPA Community Pharmacy Division has been very active over the last 2 decades. We are focused on doing various development and advancement of community pharmacy related services, training of pharmacists, providing improving pharmacy services and pharmaceutical care, and ultimately working towards patient welfare. We are associated and coordinate and collaborate with various organizations across the world, as well as various pharmaceutical companies, so that we can deliver better services to our pharmacists. This is one of our major projects over the last decade, tying up with the government as well as other NGOs. And we have trained several DOTS TB pharmacists who provide DOTS TB medicines through their pharmacies. So this is in collaboration with the NTEP, National Tuberculosis Eradication Program. We also have collaboration with FIP, and through the Pharma Bridge, we have placed several pharmacists for a 1-month training in community pharmacies abroad. So we are into developing a lot of education material, conducting training workshops and programs, and doing advocacy campaigns and webinars mainly for community pharmacists and other practicing pharmacists. This is our campaign for awareness on responsible use of medicines. Several posters we have developed in 7 languages. We are doing it since 2014, creating awareness amongst the public. This is the booklet which we released soon after that. It's a simple, ready-to-use booklet for patients on responsible use of medicines. And this is one of the posters. This is a very regular feature of ours. Every 2 months since 2012, without fail, we published the E-Times, IPA-CPD's E-Times, and just yesterday we launched the 50th issue. So it has been a long way for us, and I'm sure many of you are receiving this. If you are not receiving, please do go onto our website, and there you will get also the previous issues. This was one of the webinars we conducted in December, and we will keep doing this, and the next one will be in April. This one was specifically for Goan pharmacists. We have recently signed an MOU with the Apex University in Arunachal Pradesh to provide better training programs and better services to pharmacists in far-flung Northeast region. The first program which we did was a Jan Andolan on tuberculosis on 23rd of March. Also, to improve our pharmacy practice services, we have had an MOU just in the beginning of March with Pharmacon Society for Pharmacy Practice. This is to increase the professionalism for practicing pharmacists as well as pharmacy students across the country. Now, these were our activities in pipeline: the AMR campaign, lifestyle disease campaign, pharmacy practice research, training modules for pharmacists. So this has been in our radar. And what I marked in yellow is because that's the first step, first hurdle we have accomplished, and we have launched it, of course, with a different name because it is an evolving process. So we have launched the AMS initiative today. I'm very happy and welcome you all for this initiative. These are some of the activities we have been doing on antimicrobial resistance, different IEC material. This was the awareness campaign which we did for the World Antimicrobial Awareness Week in November 2020. This was the poster which was circulated. This was also another poster which we made. We will shortly be joined by Dr. T.V. Narayana, the president of IPA, and I will come back to this once that is done. So I once again welcome you all, and we all now go into the next step. Sunita, would you like to take over?
So Raj, I think we would either want to go ahead with the panel now, but if we are waiting for everybody else to join, we can go ahead with our videos that we can also be talking about.
No, this is the Dr. Gautam.
Okay, so for Dr. Gautam, yeah. So this is our very first step towards what we are embarking on. And as a first step, first and foremost, it's an absolute privilege and a complete honor to be associated with the IPA and to be part of this program where we are heading towards having a multidisciplinary group. Because if antimicrobial resistance is a global public problem, and we are also looking at AMR One Health. The only way we can approach the One Health is by having people from different walks of life, which ranges from infectious disease specialists all the way down to community members. It's only with that kind of a wide key stakeholder group that we could be looking at addressing this problem. So as a first point, what we're doing here is we are setting the stage to understand what is our current or immediate step to be taken towards this area. And in taking that immediate step, who are the kind of people who we are associating with, and who are the kind of people who are giving us the strong support that we need for moving this forward. So our first speaker, I mean, when we say speaker, we live in the virtual world at this point. So we have to bear in mind the cognizance of, the time between the different continents we all live on. So we have Dr. Gautam Kalyatanda. He's a clinical associate, he's a clinical assistant professor in the Division of Infectious Disease and Global Medicine in the University of Florida, Gainesville. Along with that, he is also associated with the program on the Infectious Disease Fellowship in University of Florida as the Associate Program Director. And he fulfills various other academic roles. And Fellowship Competency Committee is something that he heads. The Clinical Committee is also something that he heads as the chair. And he's the Division Education Director. His area of interest also happens to be tuberculosis to a large extent. So he is associated with the TB Physicians Network. So with this basic introduction of Dr. Gautam, I would request for the video from his side, which is an endorsement video, to be please played. Thank you.
Hello, everyone. Good afternoon. I want to thank the Indian Pharmaceutical Association Community Pharmacy Division for having given me this opportunity to talk on the launch of this AMS initiative. I want to congratulate them on launching the Antimicrobial Stewardship Initiative, which in my mind is one of the most important challenges facing health this century. Antibiotics have transformed our lives. Their discovery has led to drastic decrease in mortality associated with infectious disease. However, about 30% of all antibiotics prescribed in US hospitals was unnecessary. CDC data shows that antibiotic prescribing was not supported in 79% of patients with pneumonia, 77% of patients with urinary tract infections, and then 47% were unnecessarily treated with fluoroquinolones. This, when we know that some of the serious side effects associated with fluoroquinolones can actually kill patients. For years, microbes have become resistant to antibiotics. This poses a true and real danger to global health security. This was evidenced in the World Health Assembly's endorsement of the Global Action Plan on antimicrobial resistance in May 2015 and the political declaration of the high-level meeting of the General Assembly on AMR in September 2017. Now, both of these recognize AMR as a global threat to public health. These policy initiatives acknowledge overuse and misuse of antimicrobials as a main driver for development of resistance, as well as need to optimize the use of antimicrobials. And I'm sure some of the speakers before me or after me will dwell on that in much more detail. AMS principles also apply to the use of antimicrobials in the animal and agriculture sectors, typically with an emphasis on the responsible and prudent use of these agents. And this is where One Health fits in with antimicrobial stewardships. Today, AMS is one of the three pillars of an integrated approach to health system strengthening. The other two are infection prevention and control, and medicine and patient safety. Synergy of these three pillars is key to building a strong health system. I want to draw your attention to the CDC's updates to the core elements of hospital antibiotic stewardship program, which they say consists of hospital leadership commitment, accountability, but the most important is pharmacy expertise. This core element was renamed pharmacy expertise to reflect the importance of pharmacy engagement for leading implementation efforts to improve antibiotic use. Now, the other core elements include action and implementing interventions, tracking, reporting, and education. Now, the last one, education of antimicrobial stewardships and mechanisms, is extremely crucial as well. Now, antimicrobial stewardship interventions are aimed at various sectors: prescribers, patients, drug providers, policymakers, general public. most evidence is available for the effectiveness of antibiotic stewardship interventions at the hospital level. So in conclusion, it is my honor to support the IPA CPD in this antimicrobial stewardship initiative that they have launched. So thank you so much and wish you all the best. Thank you.
That was wonderful to hear from an expert, Dr. Gautam. Very much, Dr. Gautam. We now move on to the next speaker, who is Professor Sabiha. I would request Sunita to please introduce us.
Yeah, thanks, Raj. So Professor Sabiha is from South Africa and doing extensive work in this area. So she is a South African research chair in antibiotic resistance and One Health, and basically started leading this from the pharmaceutical sciences department at the University of KwaZulu-Natal, which is in Durban. Other than this, she plays a major role as the vice chair of the WHO Strategic and Technical Advisory Group for Antimicrobial Resistance and a senior implementation research advisor at the International Center for Antimicrobial Resistance Solutions in Denmark. From a global scale, she leads the program again as a member of the FIP AMR Commission, and she's also the chairperson of the Global Respiratory Infection Partnership. Other than this, she serves on the advisory board of the Fleming Fund Expert Advisory Group in the UK and is a member of the Wellcome Trust Surveillance and Epidemiology of Drug-Resistant Infections Consortium. So we really are extremely happy that we have the support from Dr. Sabiha, and now we are ready for Dr. Sabiha's video recording. Thank you.
Distinguished guests, colleagues, ladies and gentlemen, good morning. I extend my sincere appreciation to Ms. Manjari Garath for inviting me to the launch of this AMR awareness campaign by the Indian Pharmaceutical Association Community Pharmacy Division. I hope to leave you in no doubt that pharmacists are critical to the prevention and mitigation of AMR. I say this for three reasons. Firstly, pharmacists have the knowledge. As the primary custodians of medicines, pharmacists have extensive knowledge in the pathophysiology of infections, indications for the use of prescription and non-prescription medication, dosage forms that best suit patients, mechanisms of action, side effects, drug interactions, adverse effects, and contraindications. The community pharmacy is further frequently the first point of contact with the health system, and the pharmacist has in-depth knowledge of community and individual health profiles. Secondly, community pharmacists are readily available, as are the products that they carry. Pharmacies carry a comprehensive range of prescription and non-prescription medication that are immediately available. Thirdly, community pharmacies are accessible. Community pharmacies generally outnumber medical doctor practices in most countries and have longer trading hours such that access is facilitated 24/7. As this is a community pharmacy initiative, I want to describe 5 professional practice areas where community pharmacists play a vital role. The first is to liaise with the prescribers on antibiotic prescription. This is to promote adherence to guidelines, appropriate prescribing, and optimal treatment regimens. The second deals with advising, supporting, and educating patients on common ailments, when they need to see a doctor, symptomatic treatment for self-limiting infections such as upper respiratory tract infections, education on how infections occur and can be transmitted, infection prevention and control by vaccination and simple hygiene measures such as hand washing, and most importantly, on antibiotics. what kinds of medication they are, what are they effective for, how they should be used, what antibiotic resistance is, and why it is important. The third role is to ensure the appropriate use of prescribed antibiotics. For example, advising patients on compliance, the importance of taking the antibiotic exactly as prescribed and following the correct dosage regimen, potential adverse effects and what to do if they occur, and any risks of interactions. The fourth role deals with appropriate disposal of unused antibiotics, and many countries are implementing take back campaigns. And the fifth role speaks to health education and promotion campaigns. I believe that pharmacists have immense capacity to lead on the prevention and mitigation of antimicrobial resistance, both individually and collectively through pharmacy associations such as the IPA. I wish the Indian Pharmaceutical Association every success with this campaign. Thank you for involving me and including me on this launch.
Thank you. That was a wonderful piece of advice and guidance from Professor Sahib Sapiha. We're very much grateful to you, ma'am, for taking out your time and sending us your message and guidance. We now move on to the next point on our program, that is the panel discussion. Mrs. Manjari Garat, the Vice President of IPA and Chairperson of IPA CPD, has been a great source of inspiration for all of us. She has been leading IPA CPD since 2012, and under her, we have been able to do a whole lot of activities and keep the flag of IPA and IPA CPD flying. Unfortunately, she's not able to join us today because she's traveling and not in a position. Or are you able to speak for some time, Manjari?
Uh, Thank you, Raj.
Yes,
Thank you.
good,
Yes,
good,
my
good.
network is unpredictable. Yeah, thank you.
And congratulations on newly being elected the Vice President of FIP. And she's also the Executive Committee member of CR Farm Forum of FIP. And also, she's the chair of the FIP's AMR Commission. So that's a whole lot of things to your achievement.
It's unpredictable, but I will surely. Thank you very much who have joined us. On welcome you all again on behalf of SINS. So we are all together in this fight, and we had this on our agenda, on CPD's agenda. And Raj had this dream that we must be starting the AMR campaign. But somehow we were not able to focus on it till last year. But the FIP's development goals released in September 2020, the development goal 17, about which my colleague Sunita is going to speak more, gave us further momentum to work in this direction. Another point where we got more momentum was FIP's AMR Commission, the launch of Antimicrobial Resistance Commission by FIP. So we were inspired and motivated that we also must put our energies and strengths together to work against the antibiotic misuse. It's not that we had not worked before. This antibiotics responsible use, save lives, etc. We had the campaigns earlier also. We also have Carom campaign. But now what we are going to do is we are going to put all our energies together, have more synergy. And I'm extremely happy and thankful that we are getting so much of global support also to do this. My special thanks to Dr. Professor Sunita Srinivas for putting more enthusiasm in this team to work for this noble cause. Thank you very much. So thank you again. Great support for Gendra and Karthik and the other team members. Thank you to all the speakers who have joined today from across the globe. And thanks to all the panelists who are going to be speaking here and going to tell us. So I welcome all our panelists from different divisions. Thank you again for joining. And they will be talking to us how they are going to be part of this campaign. What would they like to do? So thank you, Raj, for this opportunity to speak, because my network is very unstable and I don't want any hindrance in the program because of that. So I request you to take over the panel discussion, but thank you again to everyone.
Thank you, Manjari. Continue to be connected. And I welcome the panelists who have joined so far. If the others join in the meanwhile, we will also welcome them and include them. So we have with us today, those who have joined are Dr. Subhash Mandal, who is works in the West Bengal Drug Regulatory Department and who has been a very active and dynamic Vice President of IPA for several terms, and he heads the Regulatory Affairs Division. Welcome, Dr. Mandal.
Thank you, Raj. Thank you, Raj, for your kind introduction.
Also, Dr. T. Satish is joined from the Industrial Division because the chairperson could not join. We welcome you, Dr. T. Satish. We are very happy to have you here.
Thank you.
Welcome. Also joining us is Ms. Pragna Ella, who is the chairperson of the IPA Students Forum. IPA Students Forum is very active and dynamic, and under the leadership of Pragna, I've been doing a whole lot of activities and for students as well as the community, and we're very happy to be associated with IPASF. The young blood charges us and pushes us also to do better. Thank you and welcome, Pragna.
Thank you so much, sir. It's really our pleasure to be a part of this program. Thank you.
Thank you. Now I will initiate this discussion by asking questions, and I would request the three of you, one by one, you could answer. The common question is, what steps has your division taken or done to address the challenge of antimicrobial resistance in India? Dr. Mandal, would you like to go first?
Am I visible and audible?
Yes, sir.
Okay. At first, I would like to thank to the Community Pharmacy Division for taking up this issue formally. But this is not new for IPA. IPA is working on this issue directly or indirectly since last 3 decades. We are working on rational use of medicines, including antibiotics, for last 3 decades, and we have also presented such report of the studies in different international symposium, and our honorable resource person Sunita might be knowing about it. Raj is also witnessed that program. Actually, WHO has set up the aim for introducing this antimicrobial stewardship program.
I am Ajay Gupta.
Hello.
I am Ajay Gupta from Delhi.
Hello.
I am.
Can I continue?
Yes, sir. Yes. Sir.
Yes. WHO has set up the aim to introduce this program to optimize the use of antibiotics. We have already taken up this issue in different way through our branches as well as our division, and we have started a program, and especially in West Bengal, we developed one feature film on rational use of medicines, and we are also showing this feature film in schools, clubs, and a place where people are gathering, as well as in meeting of stakeholders. Regarding this, the another aim is to change the behavior of antibiotic prescribing. We are also advocating our prescribers to prescribe rationally and dispensing practice. This is very important in our country because you can get any antibiotics from the retail medicine shop, and that because of this self-medication, it creates resistance to each and every medicines. In this case, government also taken up some issues like creating another schedule H1 to restrict the use of some precious antibiotics. We are also advocating the government of India to be strict and to implement this, as well as to direct the prescriber to follow the rational prescription. As a result, that IMA and government of India, they have advised the doctors to follow the rational prescription. To another issue is this, developing resistance is availability of a number of irrational combination of antimicrobials available in our market. So we are advocating our policymakers, the government of India, as well as the CDSCO, to restrict the irrational combinations, either stop granting or withdraw from the market. Thirdly, there are misuse of this antimicrobial by animal healthcare, and this in case of different hatchery, and in case of they are used this antibiotic as a growth material for some fishes. So we have already taken up the issue with the relevant authority of government. Another issue is the pollutant emitted from the factories who are manufacturing these antibiotics, and they are not treating this effluent properly. So we are also requesting them to stop it or properly treat this effluent before discharging it to the water body or the soil. These are some of the issues we have already taken up and we will continue. But the greatest role is amongst the community pharmacists, where anything and everything can available without any prescription. So thank you very much. This is our thinking. Thank you.
Thank you very much, Dr. Mandal, for your elaborate answer, as well as suggestion, as well as the good work that has been going on in West Bengal as well as through IPA. May I now request Dr. T. Satish to spell out what steps the Industrial Pharmacy Division has taken against the challenges of AMR in India. Dr. Satish. Is he there? Or if he has dropped out?
I think there is some technical issue, sir. You can go with other person.
Yeah. Pragna, are you able to hear me?
Yes, sir.
Yeah. Please could you spell out what steps IPSF has taken, what activities you are doing to address the challenges of AMR in India?
Yes, sir, sure. And first of all, it's our honor to be a part of this one. On behalf of IPSF, I want to thank IPS CPD division, all members for involving us to take an active lead in this. And thank you so much. And I'm happy that Yogendra, our team member, is also there as one of the main team member of this program. And yeah, coming to our initiatives, whereas in IPA, as told by Subhash Mandal sir, IPA had taken so many initiatives previous also for this AMR. As one part of that, Mahendra Patel sir has taken some initiatives like taking pledge from all the students to be a part of this AMR and all, and bringing some awareness in many of the seminars and all. So yeah, most of the colleges, as we have student chapters, also taken part in that. And coming to the present activities and and our future plannings, mainly we want to involve pharmacy students to be a part of this one, sir. And yes, nearly one half of hospitalized patients receives antimicrobial agents, and poverty increases drug resistance due to underutilization of appropriate antibiotics. As there are many problems with IMR, like treatment failures, morbidity and mortality, risk of hospitalization, length of hospital stays, and also need for expensive broad spectrum antibiotics. So these are all the main things that are involved with the over uses of antibiotics and all. So as a part of antimicrobial stewardship program, mainly we want to focus on pharmacy students, where they used to have spend much of their academic time in a hospital. So it's the very best choice to take them into the program, because they can provide awareness, and they can be in touch with the direct interaction with the physicians and patients, so that they can bring more awareness about the usage and all. And also, by being in coordination with the physicians also, it will be somewhat beneficial that the pharmacist and physician coordination definitely bring out the good outcomes. So it will be possible with the family students, I think. So that's why we want to give in association with IPS CPD, we want to give training to the pharmacy people regarding this program. And we also will be interested to develop an institutional program to enhance antimicrobial stewardship. And through SF, we will mainly focus on attempting to reduce antimicrobial resistance rates and preserve current antibiotics. And there will be 7 core elements for antimicrobial stewardship program. First one, leadership commitment, accountability, drug expertise, action, tracking, reporting, and education. So definitely, I'm sure that the pharmacy students and all the interested of pharmacy students, definitely with all these 7 core, having these 7 core elements, definitely they will achieve this one. And then in India, we will become we will be the first in reducing all these overuses. And the 7th main thing, education. So definitely we will train all the students with the help of all our training given by IPS CPD, to encourage the patients to know and to more get aware about their uses, because so many people don't know. And for all the common things, they used to take antibiotics only. We all know that antibiotics done nothing to all the diseases, because they only help to reduce some of the symptoms only, and their uses was different. So that's why the main awareness is important. I think that family students can bring this one in a broad way if we train them in a particular in a proper channel. So that's why I request CPD to also to please conduct some programs to training programs to also the family students. Definitely everyone are interested to be a part of this one, sir. So, and yes, this is all we are planned, and we had done something in the past regarding this antimicrobial stewardship. Definitely, I'm sure that our combination will do excellent things for this program. Thank you, sir.
Thank you very much, Pragna, for the activities and the wonderful work that you have been doing. And we're also very happy to be associated. And thank you also for spelling out what you expect and how you would like to collaborate with IPA for this initiative, so that we can work together and expand the network, so that we can reach out to more pharmacists, more pharmacy students, and ultimately to the public. Dr. Mandal, through the IPA regulatory division, Now that we have started or initiated formally this AMS initiative, how do you intend to strengthen the collective effort that what we can do together with IPA CPD as well as other divisions? What do you feel? What are your suggestions or your inclinations of your division?
Well, RAD is also already working, I have already expressed. And we are also working jointly with CPD in some programs like CPD's program with Pfizer. That is also supported by our division, and especially I joined with this. Similarly, for this, any sort of help like advocacy at the highest level, like ministry as well as the regulatory division, we can rope them up with this program. And another very important, I'm reiterating the same issues, the self-medication through community pharmacy, that can be restricted by through advocating the regulatory personnel working in different states. So we can take up this issue to to influence them, or rather to encourage them, so that this self-medication can be limited or stopped. Or any other help you want, we are ready to help from RAD, and rather we can work jointly wherever required.
Yes, sir. Thank you very much for your encouraging words, as well as the positiveness in collaborating and working together. Thank you very much.
Thank you, Rich.
We'll now move on to the next, and I thank all the panelists. Unfortunately, some of them could not join.
Hello, Raj sir. Sorry to interrupt. Pramod sir is interested to speak regarding this. He is from Education Division.
Oh, that's very nice of you, sir. Sorry, I missed out.
Yeah, fine.
Pramod sir, please.
Yeah, thank you very much. So very good afternoon to all the members of IPA and all the participants. So as Vidyadhara sir is busy in inspection, I wanted to represent the activities of Education Division.
Yes, thank you.
So last year, actually, we have conducted some campaign for various Farm Day students, so that we have awarded individual year-wise, like they need to take the pledge, so that we have seen there might be some little change in their behavior patterns towards the use of the antibiotics, because that pledges were conducted in a series of events. So as Pragna has mentioned very well, so IP Education Division has also worked in association with the Students Forum, who are very active in our region also. So apart from that, we have visited nearby rural areas, wherein we have also understood what is the usage pattern when it comes to the veterinary use, because many a times the antibiotics use is a lot in the rural areas for the veterinary purpose. So sometimes during the sanitation also we need to keep in mind, apart from the use in the humans. So in that way also we have done some of the activities in the rural areas. So recently we were stopped for going into the hospitals, because majority of the times we are working with the pharmacy students. And from past 3 months we were actually involved in the hospital activities. So because of the surge in this COVID, many the patients were using the antibiotics in a very irrational use. So because only azithromycin was given for the COVID, so apart from that, few of them are taking doxy and all, for which we don't have enough supportive literatures and all. So our students has interacted with the physicians, and they are going to give some basic information to all the patients who are coming to the hospital for this COVID situation also. So likewise, some series of events were conducted, and we hope we will take it further. And we wanted to thank the IPS CPD division for taking a lead for this AMR campaign, which is considered to be a very essential aspect in these durations. So there are some of the activities, and I hope we will take it further from the education division in order to aware the public about this along with the healthcare professionals. So with these few words, I wanted to thank all the panelists for giving me this opportunity to share some of our news. Thank you all.
Thank you very much for your support, and we look forward to working collaboratively with you, all the divisions together, so we can make a stronger team and we can pitch in our efforts in a much bigger and larger way. Thank you very much once again to all the panelists. We now move on to the next session. So as we have seen, AMR is everybody's responsibility, and it's not the domain only of the healthcare providers. So it's everybody, and everybody has a role to play, right from laypersons to the top implementers and politicians. We of course would like to focus initially on the areas which are related to pharmacy. So that's the pharmacies and pharmacy services that we provide through hospitals and community pharmacies, the pharmacy industry and the drug regulators. Of course, the veterinary services, the animal industry, slowly, stepwise, we can always expand into that. But the first priority, of course, would be to equip ourselves, equip our pharmacists to be good antimicrobial stewards. So there are a lot of challenges for the profession on AMR, as Dr. Mandal has spelled out. Sale of antimicrobials without a prescription, that is quite rampant, and there are a lot of unqualified prescribers also prescribing. There is unfortunately insufficient guidance to patients on the importance of dose completion and to complete the dose and not to repeat unless doctor recommends to take again. Unfortunately, pharmacist is not always present at the counter to provide this guidance to the patient in our country, and pharmacy personnel also pharmacists personnel also recommend antimicrobials, which is not correct in the legal sense, and we also need to look into that. And the clinical role of the pharmacist, with a lot of PharmDs coming in, working together with healthcare professionals, that area also needs to be improved. The other challenges are that antimicrobials are aggressively marketed in our country, and there are lots of fixed dose combinations and antibiotics, including the topical ones, as Dr. Mandal pointed out. And the rationality of these is a big question mark. And there is, of course, a lot of irrational prescribing and usage. So our initiative wants to gear up initially the pharmacists in antimicrobial stewardship. And the pharmacists have a lot of role to play. I will not dwell in detail on that. So step by step, we have to move forward, equip ourselves, and try and play as much role as possible in each of these different areas, including the interdisciplinary approach and working collaboratively with other healthcare professionals. So our first step obviously would be to equip the pharmacists. That's what this AMS initiative is about, and the pharmacy students to take our fight against the AMR. We need to disseminate the information to the public because there is a huge unawareness amongst the public. So we have a good network of pharmacists, pharmacy professionals and students, and we can reach out to them. And we need to work integrated with the pharmacy professionals and other healthcare professionals. And we need to do research and advocacies. So as part of the activities, we would be gearing up for training of community pharmacists and their staff, the hospital pharmacy and their staff, the clinical pharmacists, and of course the pharmacy students. We also would like to take up for the public a lot of awareness through social media, as well as using the pharmacy staff as well as the pharmacy students. So we have to have the sustained national campaign on AMS if we are to succeed. So our next focus would be, stage 2 would be to focus on practice research so that we gather evidence of the inappropriate practices and document the benefits of pharmacist involvement, and also advocacy with various authorities, which of course Dr. Mandal has suggested. We all would work together on this. Because ICMR has laid down guidelines for AMR, and they have spelled out the role of the pharmacist, but unfortunately it's not being implemented. So if the onus is also on us to make the best out of it. So our campaign has to be sustained, and we have to reach out to other healthcare professionals. So for this, we seek the involvement, suggestions, and ideas from all of you. As you see, we have not formed a fully formal structure of this AMS initiative because it is evolving. We are shortly going to announce a competition where we want to have a logo for the AMS initiative. We want to have a slogan for the AMS initiative. And very shortly, maybe in a day or two, we will announce the competition for this. And for this, we would seek the involvement of pharmacy students as well as any pharmacist in the country. And we seek your active contribution in that also. And now we move on to the next presentation, that is by Professor Brett. And I would request Sunita to please introduce Professor Brett.
Thanks, Raj. So I think, we have set the scene extremely well because we have started with what we intend to do. We have looked at where the panel members contributed extensively well to talk about the synergy that is feasible. But what was extremely heartening is the equal ownership that we are looking at, because that's where it goes as a common vision. And when we are working towards all of this, one of the key aspects that we need is definitely behavioral change. If you look at behavioral change, this is not just needed for how the prescribers will prescribe or how we want the patients not to self-medicate or how we want the patient's behavior towards completing their course to be the antibiotic course. All of this, any aspect you look at, whether it is at a policy level, whether it is at an implementation level at the healthcare systems, or whether it is at the level of the patient and the community, at the bottom line of all of this, we are humans. And as humans, one of the most important thing is the health communication that needs to be happening. So I think what is extremely important here is the solid support that we have from Dr. Brett Craig. He was an academic at St. Louis College of Pharmacy, which was one of the common points between Raj and myself as well. But also, now he has moved on completely to be the WHO consultant for various projects he is working towards. So from what we can see in a short bio, he is a project lead for the WHO Regional Office for Europe at Kazakhstan, at Denmark, and he has also worked as a researcher for the Karuna Trust project, some of which will come through when Mr. Samson from Karnataka State Pharmacy Council will also be presenting. So Dr. Brett Craig played an extremely important role in initiating this program for us at Karuna Trust, one of the NGOs that is a public-private partnership, where we have the antimicrobial stewardship program happening in 29 primary healthcare centers. Of course, there's a lot that desires to be done, but it is all about who helps us initiate and how we take it forward from there. And he has been an academic in the past as an associate professor, and he has also been a part of what was happening in South Africa as a research lead for one of the Nelson Mandela universities, which was very close to where I was at Rhodes University. So some of the key areas of expertise that Dr. Brett Craig brings in, which will be extremely helpful for our program on antimicrobial stewardship, are his areas in social and behavior change, health communication, and he also played a crucial role in initiating the quantitative and the qualitative research and analysis methods for us while he was here. And he contributes a lot towards the project design and implementation, as well as the monitoring and evaluation aspects when we are working on proposals. And he has a lot of experience in the curriculum and training design. So this is a very brief introduction to something that Brett leads in an extremely proactive manner. And here's a video from his side for our program. Thanks, Yogi. You can go ahead with the video, please.
Greetings, everyone. I'm very happy to be speaking to you today. I'm very happy to be supporting this important initiative that is taking shape with all of your support. And I'm happy to add my voice to everyone else's Important initiative that is taking shape with all of your support. And I'm happy to add my voice to every.
Hello, ma'am. You can hear me, right?
Yes, I can hear you, Yogi.
Yeah, 1 second.
Even if the voice and the video are not synchronizing, let it go ahead because the message is definitely coming through clearly.
Sure.
Important initiative that is taking shape with all of your support. And I'm happy to add my voice to everyone else's who will be being involved in this important work as the needs around antimicrobial resistance are being addressed through professionals such as yourselves. As a behavioral scientist, I'm very interested and I care a lot about helping see, identify, and improve the behaviors surrounding such problems that face the health challenges of the populations. And so antimicrobial resistance is indeed an urgent need that needs to be addressed in India, as well as many other places in the world through multi-level interventions, including the development of AMR policies, strengthening of local governance of antibiotics and stewardship efforts, but also it involves a lot of behavior change, and that includes changing beliefs, norms, behaviors of both health professionals and other individuals in relation to antibiotics, including patients and their use of these medicines. India's diverse challenges ranging from policy to practice at local levels among various populations requires a lot of adaptation, targeted approaches, understanding different populations and their needs and challenges that they face when they are accessing medicines, taking medicines, following up with their antibiotic use with health professionals. And these efforts and these understandings of how these processes work can be strengthened by health professionals such as yourselves. And I encourage you to continue to work to solve these problems through multidisciplinary teams, because these are, in fact, multidisciplinary problems. They require professionals from various backgrounds to understand the different aspects of the problem around antimicrobial resistance, and how not only are the policies necessary to strengthen, but also the behaviors that often don't always coincide with the policies and the expected outcomes of policies. And so looking at individuals both involved with the procurement, the storage, the prescription, the delivery, and also the taking of the antibiotics, understanding their motivations, but also understanding what are their challenges, what are their barriers to improving those behaviors around using antibiotics responsibly. And so it is with my support that I offer to you that these are challenges that need to be addressed, and I look forward to learning more about what this initiative will accomplish, what it will work on, and how I might be of service.
Hello, ma'am. Actually, I'll be like playing from my iPad, ma'am. I think there was like a non-sync. Just hold on for a second. Raj sir,
yeah,
can you just stop it for a second? I'll just do it from this. Yeah, thank you.
Greetings.
So till
the people, as well as it takes a lot of different professional backgrounds in order to address these issues. Many patients face challenges such as low health literacy. Many patients are migrant workers who face additional obstacles. They aren't always in the same place for very long. They can't follow through with medications the way that people who are more established can. There are also many perceptions of quality of medicines that interfere with people listening to health workers. There are competing priorities between public and private facilities. There are also other traditional methods of treating disease and healing that also can conflict with understandings of taking medicines such as antibiotics. And so there are many different challenges out there that I'm sure many of you are aware of. What's important is that in examining behavior, we don't result to making assumptions that are very narrow in their scope. Too often as health professionals, we assume that any patient behavior that isn't what we would desire is due to a lack of motivation on the part of the patient, that they just don't care enough. And that's a default assumption that we often make. However, research shows us that behavior is actually more complicated than that. There are more influences or factors that come into behavior. And one of those is motivation. It has to do with a patient's desire to follow through, or their willingness to do what they are instructed to do from a health worker. But there's also other factors that take a role in this behavior. Some of those factors are knowledge and health literacy of the patient, as well as environmental factors such as their social environment, as well as their physical environment, and how work schedules and socioeconomic status and competing priorities can interfere, as well as competing information, misinformation, and other sources of incomplete information that cause confusion or do not help a patient understand the seriousness of following through with adherence to antibiotic use. And so there are many challenges that there are to be addressed through this initiative that I am very happy to be hearing about this plan, that the Antimicrobial Stewardship Initiative will press forward and strive to address these challenges in a holistic way, identifying all the needs that need to be strengthened, using the people that are involved, learning from them, involving them, strengthening their decision-making and their behaviors in sustainable ways so that real change can happen and better stewardship of these important medicines can be achieved. And so I wish you all the very best, and I thank you again for this opportunity to speak to you and offer my support for this initiative. Thank you.
Thanks, Yogi.
Yeah, fine, ma'am. So, Raj sir, I hope you can. Right. Okay.
Yes, moving on to the next session. It is now my pleasure to introduce co-host with a rich experience of antimicrobial stewardship. It is Sunita Srinivas, a PhD, a pharmacist from Bangalore who has grown out and had moved out to South Africa and is now currently the visiting professor in Rhodes University, Grahamstown, South Africa. So she is the co-lead for the Antimicrobial Stewardship Initiative, which we are launching today. She is also the principal investigator for the Antimicrobial Stewardship Project at Karuna Trust, Bangalore. She is the technical coordinator for the Antimicrobial Stewardship Program at the Karnataka State Pharmacy Council. She is also a SIG member of the Indian Pharmaceutical Association Community Pharmacy Division. She is the mentor professor for Apex Professional University in Andhra Pradesh, and also a visiting professor to the B.M. Reddy and Acharya College of Pharmacy in Bangalore. She has initiated and managed the Rational Use of Medicines program for the Karnataka State Pharmacy Council as the provincial technical coordinator for Rational Use of Drugs program under DISPRUD, that is the Delhi Society for Promotion of Rational Use of Drugs, and the WHO India Essential Medicines program between 1999 and 2003. With this, I introduce the ever enthusiastic Sunita. Please take over and do your presentation.
Thank you, Raj. Can't ask for a better introduction or a better co-lead to be working with. And thank you so much for all the kind words and the introduction.
Can I move your slides?
Yes, please. So I will, yeah, thanks. So basically what I have put together here in 9 slides is a very short summary of the story. So in the first slide that Raj will now project, it is talking to us about where are we starting and what is going to be our leading document. So it is the National Action Plan on Antimicrobial Resistance, which is from the Ministry of Health and Family Welfare, Government of India, which is definitely our leading document. So if you even look at our launch poster, the 6 key areas that the national plan is working towards is where we are also heading towards. So this is our mother document. And thanks, Raj. And from this mother document, what we see is the 6 areas, sorry, we are still on the 6 areas that we are going to focus on. And to a large extent, Raj has explained to us as to what are going to be our focal areas, because based on our strengths, where do we want to go? But now what I really want to appraise is, this is not just based on the strengths of a few of us who are enthusiastic and absolutely on this path of making a small difference. We are now backed by different people. So based on what Dr. Subhash Mandal spoke to us this morning about, based on what Dr. Pramod told us, and based on what Ms. Pragna has told us, whether we're looking at the generation that gives us the wisdom and the experience, and we are looking at the young blood that Raj was talking about from the IPASF, which is definitely the next generation, and therefore the future leaders are the ones that we are working with. So when we look at this wonderful combination between where we draw the wisdom, the strength, the synergy from, as well as looking at the next generation coming into all of this, these 6 big tasks don't look massive at all. They are there, yes, but they are there and we can deal with them only because of this absolute synergy and equal ownership. So the stress, as much as it is on the synergy, the greater stress is on equal ownership. It is about every division of IPA becoming a strong team member where we are each other's safety net. We rally for each other and we make this happen, because the collective we is what we are working towards. We are not working towards one division trying to supersede the other. There's no competition here. This is plain collaboration, unadulterated collaboration. So in this unadulterated collaboration, the different strengths that we will rely upon, for example, from the IPA regulatory division, would be in reaching out to the ministry levels and to the other advocacy related partnering that we need to happen, because you have the strength, you have the wisdom, you have the courage to be doing what you're doing. If you want to look at raising the next generation with leadership, with optimizing use, with infection prevention and control, with knowledge and evidence, because without research and development and knowledge and evidence, we don't know where we are heading. And ultimately, if we want to start talking to the communities and all the way right up to the policymakers, awareness and understanding, this is exactly where we need that common goal. And we all need to be going towards that common goal in a united manner. There is no space for petty politics. There is no space for holier than thou status. There is no space for any of this, because whatever we have done in the past is done and dusted. This is a new beginning. It's a new clean slate. And we may never have this opportunity ever again. The reason is, COVID, if it has not taught us anything, I think the one thing it has taught us is united we stand. If we all work towards one common goal, that's the only time we work. As a single person, we can't go anywhere fast. So this is where I really would like to quote Nelson Mandela's quote: if you want to go fast, go alone. If you want to go far, go together. So if we want to look at these 6 goals, that is crucially important for our country, that is crucially important for us as pharmacists to be working towards, that is equally important for us to be doing as a multidisciplinary partners, then we really have to work together. Next slide, please, Raj. So one other thing that is really leading us into all of this is looking into the direction of where we are going globally. Now, what is happening in India leads to what are the actions we take, but we are also drawing inspiration, as rightly pointed out by Manjari, from the FIP developments. So in September 2020, the FIP released this 21 development goals. The next one, please, Raj. And among these, the one we are focusing on is the goal 17, which is the antimicrobial stewardship goal. So these are the documents that are going to be our guiding documents. We don't want to recreate wheels. We don't want to start something that has that doesn't have the collective wisdom. When we look at what FIP is doing at an international level, where pharmacists should be heading, and what the Ministry of Health and Family Welfare is doing for our country, these are our 2 crucial documents. This is what will guide us. Next slide, please, Raj. And what we also have to bear in mind is when we are doing these development goal related work, it calls for, Raj, the next slide, please. It calls for working together, whether it is from the research angle, whether it is from the angle of stewardship, whether we want to look at medicines and therapeutics committee to be set up in the hospitals, etc. So basically where we are heading is, whether we talk about a policy related aspect, whether we talk about the healthcare system strengthening aspects, or whether we are talking about at a community level, how do we promote what we need? I think everything synergizes to the same goal that the antimicrobial stewardship wants to achieve. Now, Yogi, would you be able to share? Yeah, thank you. Thank you for being that quick backup, Yogi. So this is where we are heading, and we have just, I've finished with all of those, Yogi. Even the next 2 are done because I was talking about the FIP goals. And now we are going to that next slide, which talks about sustainable development goals. Now, why do we need to focus on sustainable development goals? India, as a member state of the United Nations, along with the 194 countries, we are all working towards that sustainable development goals. This started in 2015 and it ends in 2030. Now that we have these sustainable development goals, we need to also understand what Brett was telling us. The diverse challenges that we have means it is an extremely complicated situation. In an extremely complicated situation, the very first step to say is, where are we interconnected? Where can we not be the silo and try to work as a silo? We can't say that, okay, we are pharmacists, we are in the healthcare system, we have to only look at the Sustainable Development Goal 3 because it speaks to good health and well-being. We will be making the biggest mistake when we do that. If we don't understand that, if antimicrobial stewardship activities are not taken up, if they are not taken up seriously, if our inaction or very half-hearted action continues, then we are disrupting a whole lot of things. We are looking at the no poverty, which cannot happen because with poverty comes all the social determinants of health. And with the social determinants of health comes the increase in infections. So if there is increase in infections, we need to use more antibiotics. So we need to see that link. Then comes the zero hunger. Now, if there is malnutrition, it is obvious that based on bad socio-economic aspects that the majority in this country are dealing with, the number of infections are going to be high. If the number of infections are going to be high, then if we're also looking at our maternal mortality rate and the infant mortality rate, they will not improve irrespective of what we do in the health sector. Because what is triggering all of this is the malnutrition, which is the socio-economic aspect. If you look at decent work and economic growth, if people are poor, if they don't have sufficient education, if they are malnourished, then what kind of decent work and economic growth are we looking at? As individuals, if we are not strong and healthy, health and development are intricately interlinked. So that intricate interlink can only be sorted when we as healthcare professionals understand that we cannot and should not be going with the biomedical model that if there is a disease, if there is medicine, we are sorted. No, we are not. And if we have used those very important medicines, which are the antibiotics, in the most irresponsible manner possible, when we are supposed to be at the top of the food chain and supposed to be the most rational creatures on this planet, it just does not speak highly about us. When we do all of this, something we always forget is the reduced inequality. If you look at what COVID is doing, it is tearing us apart in terms of that increased inequality, because people who needed the daily jobs are the ones who don't have those daily jobs. So the more inequality we're going to have, the more malnourished we are going to be. The more malnourished we are going to be because we don't have decent work and economic growth, the more poverty we are going to have. The more poverty we are going to have, the more infections we are going to have. The more infections we have, our maternal health, child health, none of this are, the stats are not going to change. So we are in this very intricately connected cycle. If we don't pay attention to a whole lot of these aspects, sure, as a pharmacist, I can't go and start having discussions about zero hunger. Somebody else in some other field has to be aware of it. But as much as they are doing what they're doing, we also have to be extremely cognizant about these aspects and say that if we want to attain sustainable development goals, one of which is antimicrobial stewardship, which is dealing with all of this, we better be aware of all the disruptions that are happening and are feasible. Next one, please, Yogi. So this is where the interconnectedness comes, and this is where the universal health coverage comes and need for essential antibiotic comes in. Next one, please. And while we are doing that, we need to bear in mind that there has been a discovery void with antibiotics. This is again where, as humans, our magnanimity or our rationality did not shine. What is shining is our capitalistic model. If you invest more money in chronic disease-related medicines, then you have patient for a lifetime. Now, if that is what is driving our market without understanding the challenges of a discovery void in antibiotics, then we really haven't done the right things. And history will hold us accountable. History will hold us accountable when we have not chosen the right things, when we have not done the right things. So this is where One Health needs to come in. We can't, as a pharmacist, put on the blinds and say, okay, diseases, medicines, sorted. Not sorted. If majority of the antibiotics, if more than 75% of the antibiotics are being used irrationally for agricultural production to increase, and in the veterinary sector and in the meat and milk industry, then what are we talking about? So even if you're not looking at a rational use of antibiotics in humans, but if the irrational use of antibiotics in agriculture and meat and milk and veterinary sector is resulting in antibiotics entering the food chain and coming inside the human body, then we have lost the game even before we start the game. So we need to understand where we are doing our mistakes in a blind fashion without seeing the links. So again, it comes back to what I keep saying, connecting the dots. Next one, please, Yogi. And from this, we now have to move into, this is my last slide, we have to move into what are other countries doing different and better? What can we learn from them? For example, sure, I mean, the slides can always be shared. I've given the URLs and I have to thank Shraddha Patnala for doing this for me. We have to look at how do we now ensure that we have evidence to give us the direction that we need to take. So for example, here you see that different countries in Europe are tracking how much of antibiotics are they using. If we can have this kind of open stats available about India, how much of irrational antibiotics do we have? How many antibiotics are being used irrationally based on how it is sold in the retail pharmacy? How are we doing the biggest criminal activity in making sure that, you know, our TB programs and the second line of medicines that we definitely need to preserve are being misused rather than being used properly? If we don't have all of these numbers and we shove it under the carpet because we don't want to see it, being an ostrich and sinking our head in the sand is not going to take us anywhere. We need to get our heads off the sand. We need to face the truth. We need to be honest about what we are facing, and we need to be together in this, because without each other being each other's safety net. There is no way one person, one organization, one division of IPA will achieve any of this. So I think where I would really like to end my talk is, we need each other, not because we need each other for each other's sake, but we need this for the next generations to come. As pharmacy professionals, as people who have been in this profession, it is our individual, our moral, and our professional obligation to work with each other in order to make antimicrobial stewardship a success, not because IPA CPD is leading it, but because IPA is leading it, and under IPA's big umbrella, we all need to put our strength and our shoulders to the same wheel. So I think with that, I will end this part of my presentation. And Raj, please take it forward from here. If Raj is not online, what I will do is I will introduce Samson. So what is always the biggest pleasure in life is when your mentees are marching ahead based on where they started and where you want to see the big goal to be going. So it is an absolute pleasure to be introducing Samson, who is the Deputy Registrar of Karnataka State Pharmacy Council. And along with that, he has been the Drug Information Pharmacist at the Karnataka State Pharmacy Council Medicines Information Center. Now, Samson is someone I rely upon, not just as a professional colleague and as a mentee of mine, but he's someone I can always rely upon and just is a phone call away for a whole lot of projects that we have been doing since 2018 in the area of antimicrobial stewardship. So Samson, over to you, please, and keenly looking forward to your presentation. Thank you.
Thank you, madam, for that good introduction. And first of all, good afternoon, everybody. I thank the IPA CPD for launching this AMS initiative in the country. And also I thank all of the delegates, panelists who have joined for this initiative to launch this program in a wider way in the state or in the country. And especially thank Raj Vaidya sir also, who is taking the lead as a panelist. Today I'll be going in detail about the antimicrobial stewardship initiative in the state of Karnataka. Already we have done through various experts who has informed us what are the initiatives they have taken up and various challenges which we are facing and various things we have already discussed. So I don't want to go in detail. I want to just within a span of 10 minutes or something, I want to just brief up what are the initiatives which we have taken up for the state of Karnataka. And already Sunita Madam has told, from 2018 onwards, we have just started this particular program in collaboration with the Karnataka State Pharmacy Council for initiating all this antimicrobial stewardship program in the state of Karnataka. As everyone is aware, the antibiotic resistance is one of the world's most pressing public health problems, resulting in almost a major thousands of deaths per year all over the world. One of the main contributing factors is the antimicrobial resistance, and also we are now into part of this, and especially the IPA-CPD has taken this initiative as a launch program in today's scenario. As a representative from Karnataka State Pharmacy Council, I just want to highlight, because it is not only that I am looking after the Drug Information Center, we are also catering to a large community of registered pharmacists in the state of Karnataka. As on today, almost 64,000 pharmacists are registered in the state of Karnataka. And today's highlight is mainly the role of pharmacists in promoting the antimicrobial stewardship program. As you are aware, the antimicrobial stewardship is having a major role for the pharmacists to play. That is starting from improving the clinical prescribing habits, educating the patients, their customers, how the antibiotic should be used, how it should be utilized for their day-to-day activities, etc. So much initiative can be taken up by the registered pharmacists or the pharmacists who are working actually in the hospital or the community sector. And in Karnataka, among the 65,000, around 28,000, almost 28,000 people or the pharmacists are having or are the licensed pharmacists. That means they are the actual pharmacists who are working in the community sector as well as in the hospital sector. That means the licensed pharmacists in the state of Karnataka. So we are trying to reach out to the 25 or 28,000 pharmacists who are actually practicing as the pharmacists who are catering to the needs of the patients or to the public in a general or in a larger way. So KSPC, as everyone is aware, it is a statutory body, and we have initiated, or Sunita Madam also is a pioneer in initiating the Drug Information Center in the year 1997. And KSPC has continued with a trail glancing with several initiatives for the first time in the country, which include continuing professional development programs, rational use of medicines, training programs. It has happened for the doctors, it has happened for the retail hospital pharmacy, as well as it has taken up various initiatives for the total well-being of the pharmacist community. Not only that, KSPC has taken up various projects with important collaborators such as Indian Pharmaceutical Association, as today we are gathered today for that particular event, Delhi Society for Promotional of Rational Use of Drugs, Karuna Trust, Karnataka State Drug Logistic Warehouse Society, then Karnataka State Pharmacist Association, ESI Association, National Integrated Medical Association, and so many organizations as well as the WHO India. So we have already taken a various steps in promoting the various training programs in general, but now we are going to focus more on the antimicrobial stewardship development program. Since, as Madam told, since January 2019, the KSPC has taken the leadership role in initiating the antimicrobial stewardship activities. First, just I want to tell a brief experience. During the March 2019, that means around December onwards, I and Sunita Madam was on call regarding discussion of how to implement, how to go about with the antimicrobial resistance program in the state of Karnataka. All these were going on from many days. During March 2019, Sunita Madam has approached our Karnataka State Pharmacy Council registrar as well as the executive committee, along with Dr. Manish Paul, who is the head of research in biological sciences, Acharya Institute. So they approach us and they have proposed a particular project for the state of Karnataka. So it was antimicrobial resistance stewardship in the state of Karnataka. And this was a very large project which should have taken place from 2019 to 2023. It was planned to take up in phase-wise. It was mainly focused to the community-centered and transdisciplinary health system strengthening stewardship project to engage all public health, social, and biomedical sciences in the Karnataka for synergistic activity to conduct this ARMS program. So initially it was discussed with our executive committee, and within one meeting itself, the executive committee has given a go-ahead for permission for taking up this particular project. Kindly go back to the second slide because this is already, we are in the little forward. Yeah, you can just be here for some more time. And as we have already discussed all these aspects in detail, stating that India is the largest consumer of antibiotics for the human eye, and especially in the food animals, as already the other delegates have expressed that India is the fourth highest in the world to use the antimicrobials in the food animals. Not only that, the large consumption of antimicrobials due through several channels has reached a particular stage where we all are now, today it is discussed that we are into a resistant system. Not only that, the national AMR containment policy has highlighted certain issues during the last 10 years that already we are in the discussion schedule H1 drugs. It is very much specific to specific antibiotic to regulate the sale of antibiotic in the state in the India. Not only that, there are certain color code antibiotic used for the coding the strips of the antibiotics. Red line campaign, which is already it is in the progress from 2016. So all these are some of the initiatives taken by the National AMR Containment Policy Group. Next slide, please. So the India's National Action Plan on Antimicrobial Resistance started from the year 2017, and it was planned for 5 years, that is till 2021. It is addressed in the National Health Policy in 2017. It can be available in the link given below. Next slide. So these already Sunita Madam has highlighted. These are the 6 action plan developed by the India National Action Plan, which should be discussed in detail. And at present, the Karnataka State Pharmacy Council, under the guidance and leadership of Dr. Sunita, we are just marching for achieving these particular goals. I will be just individually focusing only. I will not be highlighting all this. I'll be just individually starting from the first point. What are the achievements which KSPC was able to do in the last 1 or 2 years? I'll be highlighting that. Next slide, please. Yeah, this is the first to improve the awareness and understanding of AMR. KSPC has taken an initiative in the year 2019. As I already told, during the March or April, our executive committee has approved to go ahead with the antimicrobial stewardship program. And during 6th July 2019, there was a leadership meeting which was addressed to mainly focus the AMR policy gap in the state of Karnataka. The pictures which you are seeing are various eminent people who represented that particular meeting, along with the various delegates who was joined for that particular program in the state pharmacy council, that is in Bangalore. The objective of this program was mainly to formalize the administrative and operational activities with the key allies for synergistic stewardship activities with different institutions like various pharmacy colleges like Acharya Institute, Alamein College of Pharmacy, and various things. Not only that, it was also enveloped with the Karuna Trust and Institute of Public Health and St. Louis College of Pharmacy, USA. In this particular program, we are joined by various speakers, especially the main speaker was Dr. Rainier Kotzi, who was a clinical pharmacist from the University of Western Cape, South Africa. And he shared his South African National AMR Policy program established in the country South Africa. Not only that, it was headed by various panel discussions like Professor and HOD of Nursing College, Family Physician Department, medical doctors, dentists, and academic pharmacists and student pharmacists. The outcome of this particular program or this particular meeting during this 2019 was the antimicrobial stewardship, or the contribution for the antimicrobial stewardship, is not only by one department, as already we have discussed. It is the responsibility of all the communities, starting from the hospital pharmacists, community pharmacists, doctors, dentists, nurses, etc. So all the group join hand together, we should be able to promote this antibiotic stewardship program. Not only that, we have to do a surveillance program, patient and public education awareness, etc. was very exclusively discussed in this particular meeting. Not only with this, we have also planned to optimize the use of antimicrobial agents in human as well as the animal health, ensure sustainable investments that takes account of the needs of all countries, and to the increase investments in new diagnostic, treatment, and prevention inventions spread across the human, animal, plant, and environment health. So all these was the key points which we have discussed during this particular meeting, which was held during the July 2019. That was the first phase which was taken up by the Karnataka State Pharmacy Council. Next slide. Not only that, we have already, as you are seeing this particular screenshot, this program initiative was officially published in the South African Pharmaceutical Journal during 2020 stakeholder engagement at Karnataka State Pharmacy Council for development of a state-level antimicrobial stewardship policy. This was officially published and it was highlighted all the introduction outcomes and what are the surveillance program which we are going to adopt in the state of Karnataka, etc. All this was detailedly discussed and published in the South African Journal. Next slide, please. Next program which we have planned was a program in the Health and Family Welfare Department. It was coordinated with the AMR cell, Government of Karnataka, to assist with the first technical committee meeting. This was involved by various representatives. Health and Family Welfare Department Director himself has participated in this particular program. Then Pharmacy Council, I represented the Pharmacy Council. Drug Control Department was also involved. Agriculture Department, Environment, Nutrition, HIV, TB, Malaria, Veterinary, Finance, etc. So all these panel of different representatives represented this particular technical committee's meeting during 25th October 2019 at the Health and Family Welfare Department building. And this initiative was mainly to just focus what has to be done for the state of Karnataka to promote the antimicrobial resistance awareness in the various levels, in the community sector, in the primary healthcare center, in the tertiary care hospital, etc. So various discussions has happened. Next slide. Again, during the World Antibiotic Awareness Week, it was on November 2019, KSPC collaborated with JSS College of Pharmacy, Mysore, to conduct an awareness campaign for the community as well as hospital pharmacists as a part of a global initiative by the WHO. This was attended by almost around 50 to 60 practicing pharmacists from the district of Mysuru, and it was a very encouraging program where we were, next slide please. You can see the picture of the program which was initiated by the JSS College Vice Chancellor as well as the Principal Dr. Pramod Kumar sir, our council representative, Sunita madam, etc. So all this, all together, we have taken up a lead to conduct this program, and we were able to discuss the true facts what the pharmacist or the practicing pharmacist are facing or in the community setup or in the hospital setup when they are dealing with various type of patients. It may be prescription, it may be the OTC dispensing, etc. So we have had a very exclusive discussion on various practical challenges faced by the pharmacists in their day-to-day practice. And we have taken their feedback and we were able to address some of the issues during this program. Next slide, please. This was a group photo of that particular program which was held in the JSS College of Pharmacy. Next slide. Coming to the next point, strengthen knowledge and evidence through surveillance. This was an initiative taken in collaboration with the Karuna Trust that was already addressed by Dr. Sunita madam. It is an ongoing antimicrobial stewardship project which is underway specifically for around 29 primary healthcare centers across Karnataka. And KSPC, as a part of the Drug Information Center team, we are assisting for checking the analysis of WHO access, watch reserve classification of antibiotics consumed in the 29 PHCs in the Karnataka. And this was initiated during 2019, and some of our supportive staff was involved in this analysis process. And we have not come into a conclusion exactly, but still the analysis process is going on. And in the coming slides, you will be able to see what are the developments which are taking place in this particular development program. Next slide. Again, reduce the incidence of infection through effective infection prevention and control. This is also an collaborative work with the Karna Trust as an ongoing project for the 29 PHCs in Karnataka by utilizing the Kayakalp initiative with the national and the state government for this particular program. And this is also through Karna Trust, and this is initiated to reduce the incidence of infection. It is I'm not going in detail of this particular project, which is on the process. It is started in 2019, and it is a way ahead towards reaching this particular project. Next slide. Next is the optimize the use of antimicrobial agents in health, animals, and food. So as already most of the panelists have highlighted, it is a one health antibiotic policy. So we are also, as a state of Karnataka, we are also planning to draft a one health antibiotic policy, which should be initiated. And this is also a pilot project with the 29 primary health centers of the Karna Trust, and we are planning. It is a 5-year plan project which is submitted for the Karnataka state. It is on the process, and it was initiated in the year 2020. But still, due to the corona, there was some hindrances which has happened during last 7 to 8 months. But we were not keeping silent on this particular project. We were taking up various other training programs through the Zoom meetings, etc., for the primary health pharmacists, primary health doctors, and primary health nurses during this COVID situation. And we have also supported them with various other medication information leaflet, and we have given certain awareness program on various drug informations or various medicines which we were using during the COVID situation, especially azithromycin and various other antibiotics which we are using during the COVID situation. So there was various confusions in the health sector, especially in the pharmacist community, whether we can dispense this medicine, what will be the side effect if the patient comes to us, how to counsel the patient. So many challenges was involved during this 2020, during the COVID situation. As a part of Karna Trust, as well as by the leadership of Sunita Madam, and the part of Drug Information Center, we were training the community or the PHC pharmacists, as well as certain primary health center doctors in rationalizing the usage of medicine through Zoom meeting, etc. We were doing various activities, as well as we are doing the pharmacovigilance program during this 7 to 8 months through these PHCs in the state of Karnataka. Next slide. These are some of the we were able to promote investments for AMR activities, research and innovations. This is the National Health Policy. In collaboration, we are also looking after for the 29 PHCs in Karnataka to take up the lead of antimicrobial stewardship project for the coming days. In the coming days also, the IPA also has joined hand with us, and it will be a global, it will be a national project which will be taken up, and it will the first time in the country a state, Karnataka, is taking the lead for this particular project. Next slide. To strengthen, last but least, to strengthen the leadership on AMR. So the role of Drug Information Center, that doctors, the pharmacists, nurses of all the primary health centers together, we are planned to utilize for the rational use of antibiotic. And we have conducted several weekly training during this COVID situation, and we are also planning to continue this training program, especially for the practicing pharmacists, practicing nurses, as well as the few primary health center doctors to initiate the antimicrobial stewardship program in the coming days. Not only that, we are also developing an essential drug list along with the leadership of Sunita Madam. There are some PharmD graduates working for the essential drug list for the state of Karnataka. Initially, we will be launching with the Karna Trust, the primary health centers, and we are comparing with the WHO essential list, the national essential list, and we are trying to narrow down to the Karnataka state or to the primary health center essential list guidelines for the state of Karnataka. In the coming days, I hope that Karnataka State Pharmacy Council can take up a lead in various antibiotic stewardship program activities under the guidance of the IPA team as well as the Karuna Trust and all the other organizations which has joined hand for this initiative. And thank you once again giving me this opportunity, and I wish you all the success for taking up this project. Go ahead. Thank you. Thank you, madam.
Thank you very much, Dr. Sampson. As now we come to the close of the program, once again, I would like to thank all of you for being part of this initiative, for joining us for this launch program. We are very happy to announce that the logo and a slogan design competition has been organized by IPA CPD. The details and the links for this would be sent to you in a day or two. We request all of you to please take part and spread the word around so that we can evolve a good logo and a good design for the slogan as well. With us today also is Dr. R.N. Gupta, who is the Vice President IPA and the Chairman of the Hospital Division. You're welcome, sir.
Thank you.
Yeah, just 1 minute before that, I would like to thank Shraddha Patnala for designing this wonderful logo. Thank you very much, Shraddha. And also I'll take this opportunity to thank Yogendra Kanchapu for all the other designing as well as effectively conducting today's program, putting all things in place, the videos, the slides, and handling the Zoom link. Thank you very much, Yogendra. Yes, sir, Dr. Gupta, few words from you regarding this initiative.
Regarding this is a very good initiative for antimicrobial resistance, but related to our hospital pharmacy, the hospital pharmacist while dispensing, they should check the prescription and they should do prescription auditing. If there is any irrational prescribed prescription prescribed by doctors about unnecessary use of multiple antibiotics, it should be referred back to the doctor so that they should consider, because this is the main reason in the prescription we are observing physicians are prescribing more and more number of antibiotics. Even if you see eye preparation in the eye species, they are also writing not only one moxifloxacin, they are writing 3 or 4 antibiotics at a time. So certainly they are giving trouble to the patient. These are the reason of antimicrobial resistance. And also another cause, second portion is that the pharmacist should do patient counseling in the hospital. The pharmacists do patient counseling and they should make awareness about this antimicrobial resistance. This antibiotic drug resistance is much more. That one, this by 2 steps we can prevent this. This much only I want to say. Okay, thank you for organizing this. AMR, very good step taken by our CPT division. And certainly by propagation, we are achieving at least something we are achieving, not the full, because we cannot make whole country about this. We are trying, but the mushrooming sale in the retail store, the owners or the salesmen, they are selling even antibiotics even without prescription. We cannot control this, beyond our control. Though you have taken good step for propagating, so we will achieve something. Certainly we will achieve something. Okay, thank you very much for giving me a chance.
Thank you very much, Dr. Gupta, for your vast experience and sharing your information and knowledge. As we come to the close of the program, I would once again like to thank each and every one of you who have joined with your keen enthusiasm to support our initiative. I'd like to thank all the members of IPA CPD's team, the special interest group, as well as of all the speakers who have joined today, as well as various dignitaries who have joined and expressed their thanks and support to this event. We at IPS CPD are also looking forward for volunteers. So any of you would like to support this cause and join hands together with us, we'll be more than happy. You can connect with us through social media as well as you can email to us or contact us directly. With this, I thank everybody once again and we look forward to all of you to join us in this initiative. We'll be in touch with all of and sending across information and asking for coordination and collaboration. Thank you once again.